Welcome back to my YouTube channel. Today I'm going to be talking about mental health and mental illness. So we're going to briefly describe what mental health means and also mental illness. So mental health is how well your mind is working day to day. It affects things like how you handle stress, your mood, how you feel, that's your mood, how you think, making decisions, how you deal with life. That is getting through ordinary problems. Then how you relate to people. That would be your mental health. So having a good mental health doesn't mean you will never feel sad or worried. It only means you are able to usually cope and bounce back when something happens. You are able to bounce back. Then that brings us to mental illness. So what is mental illness? Mental illness is when your mind is struggling in a way that causes problems that don't go away easily. It doesn't go away easily. It usually means your thoughts, your feelings, behavior becomes very hard to control. You may feel overwhelmed and you may be stuck in a painful emotional stress. It can also make it difficult to do everyday things. Things like going to work, going to school, sleeping, eating, or handling relationships. That would be mental illness. A key point to keep in mind is that mental illness is not a character flaw. It's not a character flaw. It's more like a health issues affecting your mind and emotions. We know people that act out of character sometimes. Maybe they're just having a bad day and act in a way that you never really expected. That's not mental illness. Mental illness is more way above that kind of behavior. It's actually affecting your mind, the way your mind, the processing goes, and also the emotions. So mental stress, you may feel anxious before a test, taking a test in the school or exam, but you get out of it, you improve. You might have anxiety that is so strong when you go to the doctor's office, you also get out of it. That's not mental illness. Sometimes you just have anxiety, you are unable to sleep, you cannot really, relate well to your friends. It's just a temporary issue. That is not mental illness. So now that we've talked about the difference between mental health we know is just the way we act. Our mind, the way our mind acts, works day to day, how it affects things like stress, our mood, the way we handle these things, the ability to handle it appropriately. Even though we are different from person to person, but we're still able to handle some issues appropriately, but it could be a different, format, but it's different from mental illness. So now that we know what mental illness is, it's more of something that would need treatment. Who is able to actually diagnose mental illness? correctly. It has to be professionals, licensed professionals, diagnosticians that have gone to school to study these disorders, mental disorders. So those on the list that can diagnose, it could be more out there depending on where you live, what part of the world you live, the state, depending on your county, depending on, where you live, anywhere, any part of the world. There will be those people that can diagnose. But here, we're going to talk about the psychiatrist, MD or DO. That is medical doctors who can diagnose and prescribe medication. Clinical psychologists, PhDs, and PsyD. They can diagnose mental disorders and may also provide therapy. In the same place, they can also diagnose or prescribe common therapy that you might need, or write a referral to another specialist. We have licensed therapists, psychologists with clinical credentials, such as clinical social workers, licensed professionals, counselors, licensed mental health counselors. These individuals can do assessments, they can diagnose. Some places, they can also write referral or complete the clinical assessment. Psychiatric nurse practitioners where available, depending again on the state and location where you live. These ones can do the assessment, they can diagnose, and even prescribe medication. That is psychiatric nurse practitioners. Then your PCP, primary care physicians, family doctors, primary care doctors, general practitioners. These ones can also identify possible mental health conditions and write referrals to specialists. They may diagnose in some cases, they may be able to diagnose, or they can also refer you to a mental health professionals, depending on the severity of their findings. Again, also depend on the state, on the licensing in the area. So, with this being said, can somebody self-diagnose? Can you say, oh, maybe this person have it, or maybe you have it? The answer is no. It would not be appropriate to self-diagnose. Go around telling people, oh, you think you have mental illness, or you think a family member have mental illness. Sometimes it's not what you think somebody has. The behavior, when it's persistent, when you do these things and say these things, maybe someone, a professional, needs to collect some data about this individual that is constantly saying these things. We never know. It is better to go to the hospital, go to your PCP, and tell them how you feel, what's going on with you. Let them collect the data and write the required referral to a specialist. If you need the assistance, that would be the best way to go. Do not self-diagnose and do not diagnose family members, because you are not licensed to do that. It would be wrong. It's not advisable to self-diagnose or diagnose family members for mental illness. So, with that being said, I will say please like, subscribe, and share. Like, subscribe, and share. See you in my next video.